example that I give to my students is the example of the coagulase of Staphylococcus aureus, a phenomenon discovered by Andre Gratia during his thesis in the physiology laboratory at ULB. Thanks to him, I can explain how bacteria mask the surface antigens in mammalian hosts. 10 o'clock, first task, lab meeting and discussion with students about experimental problem as usual. This morning, all our alkali strains are dead and lab work is completely stopped. We briefly brainstorm on what could have killed all the bacteria. And once again, Mr. Gratia offers a clue, bacteriophages. So in fact, he was the first to describe bacteriophages in Staphylococcus aureus during his time at the Rockefeller Institute, and he became the first researcher in the United States. Back to Belgium, he continued the study of bacteriophages for years in the lab of Botteaux. 11:30, back to my office, and I check what's new on PubMed. I see a new publication by colleagues at ULB and start reading. Once again, Mr. Gratia comes to my mind. He developed a method for phage susceptibility testing that's still in use today, as you can see here on the publication. Often called the overlay technique, but also the Gratia test, consists of mixing phages and bacteria and pouring them on a solid agar plate. If phages are present, you will see lysate of bacteria forming clear zones called plaques. This method is still routinely used in preclinical study for phage therapy. Speaking of clinical application, Mr. Gratia believed that microbiology must serve medicine directly. He was a pioneer in using bacteriophages to treat infection in humans. Here, for example, you see a case of successful phage therapy for a 6-year-old girl infected with both Streptococcus and Staphylococcus. During his career at ULB, he conducted several clinical trials, some of the very first examples of using phages to treat infection. That testing phages on 50 patients showed no adverse effect and successful treatment of abscesses and erythema. Writing time. Time to write papers. In our daily work, we document, we publish, it's how we progress. Thinking of Mr. Gratia, I remind that scientific recognition depends not only on discovery, but also on visibility. In 1924, he observed the bacteriolytic properties of penicillium molds, even before Fleming's discovery. This discovery was later recognized by his friend Alexander Fleming, who wrote that Mr. Gratia might well have been the discoverer of penicillin. Mr. Gratia was truly a forgotten pioneer of the history of antibiotics. 4 p.m. scientific seminar, time to attend a scientific seminar at the Institute. Today's topic is, of course, vaccination, a field in which Mr. Gratia also made important contribution. Between 1921 and 1926, he discovered and published on how Staphylococcus, but also Vibrio and Pseudomonas, could be killed by secretion from Streptomyces, a mold that produces a mix of antibiotics and bacteriolytic enzymes. Mr. Gratia is a pioneer, this time in vaccination. On the train, I think about all the discoveries made by Mr. Gratia and how they still impact our daily work. I first knew his name for his work on E. coli, of course, of the discovery of colicin. In 1925, he described antagonism between 2 E. coli strains, a step forward understanding bacterial competition and antibiotics. Taking it further, he began studying resistance also to colicin by generating resistant strains on plates and observing the phenotypes.
And all that. So thank you so much.